All right, go ahead and restart that. We are thrilled to have you join the Treatment and Recovery Resource Meeting. This meeting is a product of the Treatment and Recovery Committee for the Governor's Alabama Opioid Overdose and Addiction Council. These virtual calls are designed to provide valuable insights, resources, and support for professionals involved in helping someone gain access to treatment and recovery resources. Each meeting, we will feature three dynamic speakers representing different organizations who will share the resources they have available to support our important work in the field of treatment and recovery. These meetings will occur on the first and third Wednesday of every month at 12 p.m., so please continue to join us as they occur throughout the year and feature new agencies with each meeting. This Zoom link will remain the same for each meeting this calendar year. Each agency will have 15 minutes to share about services and referrals, followed by 5 minutes for any questions attendees may have. We ask all participants to remain muted during the presentations. We will open up for question and answer, and you can unmute yourself then and ask any questions, or you can always put them in the chat and one of us will ask. Without further delay, I'm excited to introduce the three agencies for today, which are Big Fish, Southeastern Intervention, and Troy Regional Medical Center. So we will go ahead and start with Big Fish.
All right. I don't know how dynamic of a speaker I am, but I'll do my best. My name's Isaac Stooksbury with Big Fish Ministries. I am the executive director and founder of Big Fish Ministries. Big Fish Ministries is a 12-month residential Christ-centered recovery program. We're basically split in two main parts, 6 months of traditional recovery and 6 months of transitional recovery. And basically the way that I kind of work that in my mind is in the traditional recovery, they're not working full time. In transitional recovery, they are working full time, but in both cases for the full 12 months, they're residential with us. We were founded in 2014 and started non-residential services then. In 2016, we started our residential services. We're located in Foley, Alabama, which is in Baldwin County. And most of the residents that we serve are in Baldwin and Mobile counties. But we have served people from other states and from counties all over the state of Alabama also. Our basic services that we provide biblical counseling through the Genesis process. If you're not familiar with that, basically they go through this process with a certified Genesis coach, helps them to deal with root causes of addiction, past traumas, and to develop strategies to prevent relapse and sorry about my stutter, to prevent relapse and to identify triggers, symptoms that could cause relapse, things like that. They work through the FASTER scale with their counselor and just work through to try and with the main goal, of course, being permanent, recovery that is long lasting. We also provide basic needs, food, shelter, clothing, biblical recovery classes, as well as life skills classes, legal advocacy, case management. We help them attain ID, Social Security cards, et cetera, if they need them. We partner with local dental and medical agencies to meet those needs. We also partner with a local insurance company to help them get health insurance, because most of them don't qualify for Medicaid and Medicare. We provide job readiness training as well as job placement. Financial and budgeting classes, help them open bank accounts, things like that. GED literacy, parenting classes, and access to higher education classes and certifications such as CDLs and things like that. We provide transportation for them to and from their appointments and court appearances while they're with us. We do monthly recreational outings with them. We took them to a minor league baseball game a couple days ago. We assist in family restoration. We help them find their giftings through testing and things like that to try to connect them with the right kind of careers and things. And we also provide referrals to attend other programs if they don't fit our program, including referrals to detox. And we also host a weekly recovery meeting that's open to the public. Some other recovery programs in our area come to it. We usually have about 100 to 150 people at least in attendance every week at that meeting. We provide food for them and just support through teaching and preaching of recovery, and also try to connect them with a new community because we know we have to change our places and things. So and our people. So we try to connect them with new people, new places, teach them how to have a good time in recovery. Um, we will be expanding our services into the Bay Minette area. If you're not familiar with Baldwin County is like really long. It's the largest county in Alabama for by square mile, and so the county seat from Foley in Bay Minette is about an hour drive for us. So we're going to expand into Bay Minette. We already purchased a property and some buildings there. We have to remodel, and that's going to enable us to add 30 beds to our men's program because that's a big need in our, at least that we're seeing here, because we have over 100 men on our waiting list on the men's side. Um, Over half of our staff are people who are recovering or who are recovering addicts or maintaining their sobriety. Um, as far as if you wanted to refer someone to us or if someone wanted to apply to our programs, the best way to do that is through our website, bigfishministries.org. Or if you forget all that, just Google Big Fish Ministries in Foley, Alabama, or Big Fish Foley, you'll find us. Once someone applies to our program or makes contact with us, we try to follow up with them within 2 business days. Things that people who we would not allow would be someone who is a sex offender. We don't allow people in our programs that are on medically assisted treatment. If a person has a violent history, certain medications, background of severe mental health, we handle those things on a case by case basis. We basically receive the application. When we contact them back, we try to set up an interview if possible with the individual and try to see if they're a good fit for our program. If they're not, I mentioned before, we will try to refer them out to a program that can provide services for them. We are also not a detox facility, so someone would have to go to detox before they came to us. And most of our referrals come from word of mouth, the judicial system, EHR, and other programs that we're in relationship with. That's basically it was supposed to be 15 minutes, my 8-minute presentation. So maybe we can get out of here quick, right? But people always like it when you go short. They just don't want you to go long. So, but if you guys have any questions about Big Fish Ministries, feel free to ask me.
I did have a question. What does y'all's wait time look like as far as like how quickly do people get in?
Right now, on our men's side, it's 2 to 3 months.
Okay,
On our women's side is kind of, it could be up to a month. It's kind of fluid on our women's side. Sometimes someone could possibly get right in.
gotcha.
If someone's in crisis, we try our best to refer them, out to somebody that can take them right away.
Makes sense. Okay, thanks.
And how many beds total do you have for men and total for women?
So in the traditional, the first 6 months of the program, we have 20 for men and 20 for women, and then another 15 to 20 for each program in transitional. So total between 70 and 80 total is where we are right now. Like today, I think we have about 73 right now in our programs.
All right, thank you, Isaac. Does anyone else have any questions for Big Fish? All right, so now we will hear from Southeastern Intervention.
Hi, my name is Mary Francis. I'm the clinical director at Southeast Intervention Group. We're also known as Herringhouses of Dothan. We were established in April of 2007. We started as a 10-bed facility and have grown to hold 25 males and 10 females. We serve adults, primarily substance use. At this point, obviously, we're, as the state says, co-occurring capable. What that means is if they have medications and are stable with their mental health, we can take them. If they're not stable or they come in and need medications, we will assist with that. And if it comes to see that we're not the appropriate level, we will refer them out if that occurs. Our level of care is 3.01, so we're considered long-term residential treatment. So what that means is the ideal situation would be someone goes to detox or goes to inpatient and they want to continue their treatment, then they would step down to our level of care, where we will help them find employment. We provide counseling. We have peer support specialists and case managers. So we're there to help work with the interpersonal issues, address the mental health trauma, but also the peer support are there to help with recovery and expose them to different paths of recovery. We are not affiliated with any like no Christian based or AA, We just expose everyone to the different paths of recovery and help them find what's going to work for them. I'm a big believer on it being individualized and tailoring it to what that person's needs are and what's helping them. And then the time you can stay in the program is anywhere from a couple months up to like a year. As long as you've got treatment goals to work on, then I will keep you and help you rebuild. We get a lot of people from the legal system. And so with that, it can take a while to kind of get your life back together, especially if maybe you come in and you don't have a driver's license, or maybe you do have a license, but you don't have a vehicle. As y'all know, it takes a lot of money to live, and it takes time to rebuild if you're starting out with nothing to get back to that place where you can maybe get your own transportation, get your license back, pay your fines, different things like that. So we do that. We have an MOU with the health department, and they come in and provide like HIV education, STD education, and we get our clients treated or tested if they want to be. Obviously, that's all confidential, but we do give them the opportunity for free testing and then the educational component of it as well. Trying to think what else I have on my list. I think the biggest thing is really for admission, the mission part of it. So for admissions, we run about a 3 or 4 month probably wait list. It kind of varies, but to get into our program, you have to have the ADMH state placement assessment. I have 2 therapists that can provide those, or it can be from an outside source. So when we get that assessment, we're reviewing it. If you meet criteria, you're placed on the wait list. I try to get people door to door best I can. We do take in consideration the priority populations as well. But that is the process of getting in. And I have an intake coordinator who helps coordinate that. And then we just ask people if they were on our wait list to check in once a week so that we know kind of if you're still interested, because I'm sure as you all know, there's plenty of times people get on wait lists, but maybe they get into treatment somewhere else or they move, life happens, things happen. So we try to keep in touch with people as they're on the wait list and even refer out if it's someone in a crisis situation and we're full and unable to assist with that. As far as our staff goes, I've got 2 certified peer support, and I've got 1 that will be in the upcoming training. 8 of us are certified case managers. I'm an LPC, both therapists are licensed counselors, one's a licensed social worker, and the majority of our staff is in recovery. The clinical staff's not in recovery, but I think it definitely gives a nice balance and good exposure for our clients, just different backgrounds, different education. And our staff is, we have 10 people on staff, and we are MAT friendly. We keep medications locked in our office so clients don't have access to their medication. And then we've got staff there around the clock that's able, we have certain designated medication times where the clients can come in to receive their medications. And for all meds, MAT or not, they stay locked in their lockers that are in our office just for the safety of everybody so no one can take too many or try and take someone else's medication, things like that. And then we serve the entire state of Alabama as well. I think that covers it. I probably did not talk 15 minutes either. Do y'all have any questions?
All right, if anyone has any questions, they can either ask it, or if you want, you can put it in the chat and one of us can ask it. All right, thank you. So we will go ahead and move on, and we're going to hear from Troy Regional Medical Center.
Hey, good afternoon. Hey, my name is Rita, and I'm from Troy Regional Medical Center Addiction Services. We are both an inpatient and an outpatient detox unit. We have a board certified addiction medicine specialist here who runs both programs. We include 12-step education, case management, with the goal of ensuring that our patients get back into the community or rehab if that's what they're needed. We also, in conjunction with that, do provide an outpatient Suboxone clinic called New Passage Suboxone Recovery, because we're in South Alabama. We're between like Montgomery and Dothan. I think most people know that from Troy University. And we just don't have a lot of services for that. So about 2 years ago, we started our own Suboxone clinic to help the patients in our area. We've been in business for from 2013. We are in conjunction with the Journey Detox, that is a contracting agency. So we can provide transportation from all over the state of Alabama. So we service the whole state. We are ASAM 4. We take all insurances. So right now we'll take Medicare, Medicaid, all the managed Medicares. I'm in contract with United Healthcare. We're even taking the Marketplace United Healthcares. We're taking Ambetters that are coming out. We'll take Viva, Humana, all of them. We also will take VA patients. It's not a problem a lot. We can just get those authorizations. Also, the way to get hold of us is you can just give us a call. We can provide our information and our phone numbers to see what we can do to provide services. Anybody have any questions? I know that was quick. We were a little bit late because we were having technical difficulties. We're sorry.
You are all good. If anyone has questions, they can ask now or put them in the chat. All right. Thank you. All right, so before we end, just want to mention Debbie from the Alabama Department of Mental Health had put something in the chat. If you guys want to check that out, they're looking for people to be on a review panel. Let's see. And so just to end, thank you for joining. We hope that you were able to learn something new about a resource available to you in Alabama for treatment and recovery. Please join us on September 18th for our next virtual meeting and have a great day. Thank you, everyone.